Hello, good morning. Today's topic is cystic glandular hyperplasia. So, this is one of the first questions, one of the most important questions asked in Australian Medical Board. So, we have cystic glandular hyperplasia. I am Dr. Parvez Ahmed Rishi. I am MBBS MS ENT. Thanks a lot. Let's begin. So, it is the cystic a condition where the uterine lining, that is endometrium, becomes abnormally thick and irregular with enlarged cysts and glands and cysts, often due to prolonged estrogen exposure. So, what is the cause? Cause is the prolonged estrogen exposure, and there is not sufficient progesterone. So it is thickening of endometrium becomes thick and irregular, glands become enlarged, and there is no estrogen, there is no progesterone, and there is lot of estrogen. So then we have another that is, what are the symptoms? Periods that are heavier than is atypical. So first is heavier periods. Second is periods lasting longer than is typical. So it is longer duration, longer heavier periods, longer for longer time, menstrual cycle shorter than 21 days, bleeding between periods, and bleeding after menopause. So these are the symptoms. What are the causes? Causes are going through perimenopause. So there is perimenopausal syndrome. There is patient is in the age of menopause, which is a period of time when a person's body is transitioning into menopause, no longer ovulate due to menopause. So there is an ovulation, there is no ovulation. Take medications such as tamoxifen, which act similar to estrogen. So if they take tamoxifen, it also means that estrogen has increased because the normal estrogen they have, and tamoxifen, it behaves like estrogen. Have irregular periods, especially if they also have polycystic ovarian syndrome. If they also have PCOS, then this glandular hyperplasia, there is more chances of glandular hyperplasia. Have obesity if the patient is obese. Hormonal therapy, use estrogen for hormonal therapy without the progesterone or progestin. How we can prevent it? Taking progesterone or progestin, a synthetic form of progesterone, if they are already taking estrogen. So we can take progesterone. If they are taking estrogen, we can add progesterone. Taking a birth control pill or other medications to regulate their menstrual cycle, we can prevent by these factors. Quitting smoking, if they are smoking, we tell them don't smoke. Reaching a maintaining a weight that is healthy for them. So maintaining a healthy weight. So these are four factors. If they are taking estrogen, you add progesterone. If they are having they must take blood control pills, and they ask them to lose weight and quit smoking. Then what is the treatment? Give birth control pills, vaginal cream, injections, and IUD. Put IUD. So four things. Then we can have there is a question which is usually asked, that is a 46-year-old. So learn here, 46-year-old, it means in the perimenopausal, menopause is around. Okay, irregular period, very severe period, and 3 to 4 months for the last 10 years. She had a DNC performed in perimenopause menstrual phase. What will it show? It will show cystic glandular hyperplasia. Why it cannot be normal? Because periods are heavy, 3 to 4 months for last 10 years. Cystic glandular hyperplasia is the correct diagnosis. Why it is not atypical hyperplasia? Because there won't be, it is less common. Atypical hyperplasia is less common than CGH. So polyp, it is very less common, and carcinoma, it is very rare. So on that basis we go with cystic granular hyperplasia because it occurs in this age group, 46. Irregular periods are there, 3 to 4 months for 10 years, and we go with this. So this is the most earliest questions, one of the earliest questions which you should train yourself for if you are preparing for AMC. Thanks a lot. I hope this is helpful.